I'm Julia. I'm an occupational therapy assistant student. How are you doing today?
I'm good.
Good. Okay, I'm going to wash my hands before we get started, all right?
Okay, sounds good.
All right. So I understand that you just had some hip surgery. Can you kind of tell me about that, where it's at?
So it's my right side.
Okay. Is your incision or your scar in the front, or is it in the back?
It's in the back.
Okay.
Yeah.
So we're gonna go over some precautions a little bit, just so that you're aware before we even get started. I don't want to make sure. I want to make sure that you're not bending past your waist, so at that 90 degrees, all right, and that your toe on this right side is staying up at all times. Okay, you want to make sure your toe's not going in this way or that it's going out. So you don't want to wiggle or anything that would break those precautions at the hip.
Sure.
You're also weight bearing as tolerated, so that means that when your foot is on the ground, that you may put the amount of weight that is comfortable to you,
Okay.
but you still don't want to overdo it or put too much weight on where it's not safe.
Yeah.
Okay. Can you kind of tell me what you gathered from that?
Yeah. So I can't bend at my hips like too far forward.
Yep.
Like my foot should always be like try to point it up, no like wiggling. And then I can like put as much weight on it that I feel comfortable with.
Yep.
Kind of thing. Yeah.
Yep. And the bending at the waist, we like to say 90 degrees. It's about an L shape.
Okay.
So if you're passing that L shape, that means you're getting close to those precautions. You're starting to break them.
Yeah.
Can you tell me what your pain level is on a scale from 0 to 10?
Yeah. I'm like at a 3.
A 3?
Yeah.
Okay. All right. So what side of the bed do you typically get out on?
Typically this side,
Okay.
actually.
Perfect. That works good. We're going to be working on some dressing today. So we're going to be putting on shoes, socks. We're going to pants.
Yeah.
We're going to do some sit to stand with the walker. Just make sure that you're comfortable with all that.
Yeah.
All right.
Sounds good.
So the first thing that I'm going to have you do is I'm going to have you just bend your left knee.
Okay.
And it's called bridging. And that just kind of helps you move around in the bed if you need to while keeping that leg straight. And then you can use a gait belt to help you get out. And what you'll do, if you want to do it like this, otherwise you can just turn as long as you aren't breaking those precautions.
Right.
Lots of people like to put the belt under their leg like this and lift and pull. Okay?
Gotcha.
So if you want to do that.
Sure. Let's see. So I can go like this.
Yep.
What did you want me to bridge for again?
You can move to the edge of the bed.
Oh, okay.
Gotcha. Yeah, so you can just kind of set the gait belt down for a second, and if you want to use your elbows to just kind of shift yourself toward the edge of the bed, it helps.
Okay.
It helps to get out. Yep.
Yeah, that makes sense.
Yep.
Is that good?
Yep, that's perfect. And then you can use the belt. Perfect.
Okay. Do you want me to get up out of bed now?
Yeah. Do you feel like you're ready to?
Yeah.
Okay, we're gonna
get in the way.
Yep. I just want to keep that up so that when you are scooting to the edge of the bed, that you don't fall. That guardrail just keeps you safe.
Gotcha.
Okay.
Gotcha.
So I'm gonna have you. Yep. Kind of get up and swing that leg.
Oh, that did help a little bit.
Good. Yep.
Yeah.
Keep that toe up.
Here's that back for you guys.
Good. Okay, so I'm going to put this belt around you just to make sure you're safe.
Yeah.
So how you're sitting right now, it's kind of the precautions we were talking about, is making sure that you don't come over that waist, with bending.
Yeah.
Get this gait belt nice and snug. Just want to make sure that that's there, so if you were to fall or kind of have any balance issues with getting dressed, that we can grab you and make sure that you're safe, okay?
Yeah, sounds good.
All right. How are you feeling? How's your pain?
Pretty good actually. Probably just still a 3.
Okay, good. So the first thing that I'm going to have you do is put your socks on.
Okay.
So have you ever used this before?
No, I've seen one, but...
Okay, so this is what's called a sock aid. And what you're going to do is you're just going to use your sock and you're going to slide the open end of the sock up to the ropes.
Okay.
Okay? And it'll look something like that, and you can kind of pull it up
Yeah.
and then you'll slide your foot into the socket, but you want to make sure that you're not wiggling it back and forth,
Okay.
and that when you can use the strings to pull, but that you're not leaning forward when you pull. All right.
Yeah.
Okay. Can you show me back?
Yeah. I don't know if I'll be very good at this, but we'll see what happens.
Okay. And I'm gonna stand here just to make sure you're not breaking any of those precautions.
Okay. I think that looks okay.
Yeah, that looks good. Yep.
Okay. So I just throw it on the ground.
Mm-hmm. And you can bend that knee. There's no precaution on the knee, so you're able to bend that knee. And try not to wiggle. Yep.
Oh yeah.
You want? So you can pull, maybe pull. There you go.
Did that work?
Yep, that works. That works for you without
Keep
breaking the
my foot
precautions.
straight.
Good.
Oh,
You're good.
trying
Try
to
not
get
to-
it in a little bit more.
Yep.
I don't feel like I'm going side to side. It's more just like crawling forward.
Okay. Yep. That's fine as long as you're not wiggling that foot side to
Yeah.
side.
And just pull.
It can be tricky, so we'll work on this more to make sure that you have a good feel for it. All right. Good.
Yeah.
That was really good.
Okay, cool.
Okay. And then
Yeah, it's hard not to wiggle, but
Yep.
trying not to.
and we'll just keep working on that. It's important that you don't break those precautions.
Yeah.
Okay, good, you got it. And then you can put this sock on and you are able to,
I can do whatever I want on this side.
you can just bring that leg right up. Just make sure you're not bending too far forward.
Oh, okay.
Good,
There.
just like that. Okay?
Sliding.
Okay.
But
Yep.
it's okay. I'm good right now. I just had to adjust a little bit.
Okay.
I know the bed is lowered all that it can
Yeah.
be, but
Okay, so now I'm gonna have you put on your pants, and the easiest way to do this is to kind of crunch these pants up on your right side. Start with the
Okay.
side that's affected first, and then you can use your reacher and grab it
Mhm.
and just put it around your foot and pull it up.
okay.
All right?
Sure. I'll practice bunching it up a little bit.
Yeah.
Okay. Let's see. It's like this, and then this is a cool little tool.
Yeah, that's a reacher. Have you ever used a reacher before?
No.
It sure comes in handy now.
Yeah. Okay. And then just put it on.
Perfect. Good job watching your precautions. Good. And then
I'm probably almost there. There.
that's perfect. And
Thank
then
you.
just like when you were putting on your socks, this leg can just come right up.
Okay.
Yep. Watch. Make sure
Oh,
you're not
sorry.
breaking any precautions
Yeah.
with that foot.
Here.
Okay.
Cool.
Good. I just want to go over the precautions a little bit with you. Make sure you really, really do understand. What can you not do with your foot?
I can't wiggle it back and forth.
Wiggle it.
Yeah,
Okay.
I'm trying.
No, you're doing a good job. I just want to make sure that you
Yeah.
understand. I know it can be kind of confusing
Right. Yeah.
and it can be difficult.
Yeah.
So, okay. So I am going to have you put your shoes on now.
Okay.
So what you can do is you can use the reacher
Mhm.
and maybe start with your left shoe and get it on over here to your left side.
Mhm. And I can just put it right
Yep.
on.
Good.
Okay.
There you go.
Is it okay that I just
Yeah.
slide it right on?
You can slide it right on, or there's this thing we call a shoehorn,
Okay.
and you can use it to open up the back of your shoe a little bit and
Oh,
slide
okay.
your shoe in. But you don't need
Okay.
to use it if you don't feel like you need to use
Yeah. I feel like I can. Let me just slide my foot. Did that
Good.
look pretty good?
it. Yeah, that looks
Okay.
good.
Cool.
Okay, so now that you have your shoes on and you're safe,
Mhm.
we're gonna use this walker so you can stand up. Have you ever used a walker?
No, my husband has though, so
Okay.
I'm kind of like familiar with it.
Okay, so these are your brakes. You want to make sure that if you're not moving or that when you're going to stand that these are on, and so
Okay.
that it's not moving too much.
Yeah.
And you can put this up because we're not going to be sitting. Yep, just yep, be careful.
Yeah.
Good.
That's fine.
Okay. So I'm going to have you can push off the bed to help.
Okay.
All right? And go like this. This breaks out. Okay.
Yep.
All right, ready? 1, 2, 3. Stand. Good. Okay?
Yeah, that felt good.
That felt good?
Mhm.
All right, so now you can slide those pants up.
Okay.
Good job. All right, and now I'm just going to have you sit back down for me.
Okay.
All right?
Is it okay if I reach back?
Yep, and you can
Just
reach back, use your hands.
Mm-hmm. Just so I don't want to.
Mm-hmm. You don't want to break those
Yeah.
precautions.
Okay.
Good. Very good. Okay, and then we can just move this walker off
Out of
to
the
the
way.
side.
Yeah. Can you get this stuff up?
Yeah.
Thank you. Yep. You can just set it right on my chair if you want it to.
Yeah.
Because I'd like to lay back down if that's okay. I'm starting to get a
Yeah.
little tired.
Absolutely. How's your pain level right now?
Yeah, it's gone up a little bit.
It's gone up?
Yeah.
Can you give me maybe a number?
Like a 5.
Like a 5, so
Yeah.
you're really starting to feel some pain. Okay, well, we're
Yeah.
to the end of this just about, so I'm just going to have you get back into bed if that's how you feel comfortable.
Yeah.
So you can kind of swing that leg up if you want to.
Yeah. Should I take my shoes off before I?
Yeah.
Okay.
So you can use the shoehorn or the reacher to help get your shoes off.
Okay. I'll try to do this one first. Oop. Let's push it off. Okay.
Yep. Good.
And then this one. Can
Yep.
I like use the back?
Yeah.
Seems-
Go for it. Make sure.
Oh,
Yep. Just make sure you're not.
Yeah.
Well, good. Okay. We're gonna move these shoes out of the way.
Okay.
Okay.
And then.
Okay. And now I'm just gonna have you. Yep. You can use. So I'm gonna take this gate belt off of you.
Okay.
Okay. Now you can use this gate belt again, just like when you came out of bed. You can use this gate belt again to get back into bed if you want.
Okay. I'm just gonna.
Okay.
Think I can do it.
Good. All right.
So yeah, since I'm having pain here, so like,
Yeah.
what can I do about it?
So I'm gonna put this guardrail just again to make sure that you're safe. You're not falling out or anything.
Yeah.
Okay. So your pain went up a little bit. So you can use a cold modality. So you can put a cold pack on. You want to
Okay.
have a few layers, maybe 3 or 4 layers in between your skin.
Mm-hmm.
You're gonna feel some coldness, a little bit of tingling, and then numbness, and that's the point you're trying to reach.
Okay. What does that like help with?
Yeah, so this is gonna help with that if you're getting stiff or swelling from all the movement that we did
Okay.
today. This
Yeah.
just helps keep that swelling down, allows to keep the stiff.
Yeah. Okay.
So,
Yeah.
all right. Do you have any questions?
So like next time, are we gonna work on
Yeah.
more stuff like this, or can we kind of like go over? I kind of forgot everything
Yeah,
that we did
so
today.
today we are gonna do so today we went over some dressing. You put on your shoes and your pants and your socks,
Yeah.
and next time we're gonna keep working on that.
Okay.
We just want to make sure that you're being really safe with those precautions.
Yeah. I feel like that's what I need to work on the most.
Yeah. So and we want to get you to independence with this,
Okay.
so that as you're healing, this becomes easier for you.
Okay.
And while you have those precautions, that you can do this with less of my help.
Right. Okay.
So yeah, we'll keep working on that, and I'll see you again in the next couple of weeks,
Yeah.
and we'll continue forward with that.
All right. Sounds good.
All right, thank you.
Oh, do you want to end the video? Or do you want to do it again?